There was an old saying in cancer that the earlier that you could detect the cancer, the better a chance you had to cure it. That took another hit today when the New England Journal of Medicine reported that patients who had radicals cancer on their prostate did minimally better than patients who were simply observed who had prostate cancer. The study came out of a large pilot group of following 730 men, which had small cancers, all which were in their prostate, none had creeped out. And half of them were assigned to observe only, and half of them were assigned to undergo what's called a radical prostatectomy. When this follow-up was done after 12 years, it was discovered that the cause of death from these men was about 6% with the group who had the radical prostatectomy died of prostate cancer, as opposed to about 8.5% of the men who were observed. But the absolute difference in death rate between the men for those two groups was less than 3%. Prostate cancer surgery, or radical prostatectomy, is not a benign procedure. The most common long-term devastating results for men are sexual dysfunction and urinary incontinence, not to mention the short-term complications of surgery such as wound infection or even death, as one case was reported in this small series. Bottom line, more physicians are going to be watching small PSA tests and small cancers as opposed to having either surgery or potentially even radiation therapy. There's an old saying in surgery that if you're a man and you live long enough, you'll have prostate cancer. And if you're a woman and you live long enough, you'll have breast cancer. Clearly, these implications are different for younger individuals who have cancer. They're far more aggressive and need to be treated much more aggressively. But if you're older and have prostate cancer and are sexually active and the cancer is limited to your prostate gland and not terribly large, it's probably worth considering having your cancer observed. For your doctor's orders, I'm Dr. Terry Simpson. Good day.